1. What are the roles of a care worker? A career as a care worker is one of the few where you can have a direct impact on the quality of life of people on a daily basis. My daily goals are to enrich or assist those who are in need, but each care home resident you meet will require your care and attention in a variety of ways, such as maintaining client hygiene, facilitating social-emotional support, administering medical care, and scheduling and attending hospital appointments. 2. Duties and responsibilities of present and previous employer. My duties and responsibilities include providing personal care, administering medication, assisting with daily living activities, monitoring patients' conditions, and ensuring a safe and comfortable environment for patients. 3. Why do you want to come to the UK? I have always been fascinated by the healthcare system in the UK and the high standards of care provided. I believe that working in the UK would provide me with a great opportunity to enhance my skills and gain valuable experience in a diverse and dynamic environment. 4. Why are you looking for a care home job? I am passionate about providing care and support to elderly and vulnerable patients. Working in a care home environment would enable me to make a real difference in the lives of patients and their families. 5. Why are you interested in this position? I am interested in this position because it allows me to utilize my skills and experience in providing patient-centered care. I believe this role will enable me to make a positive impact on patients' lives and contribute to the success of the organization. 6. Can you tell me about person-centered care? Person-centered care is a philosophy that puts the patient at the center of the care process. It involves understanding and respecting individual preferences, needs, and values, and working collaboratively with patients and families to create tailored care plans. 7. How would you handle patients' or relatives' complaints? I would actively listen to their concerns, show empathy, and address complaints in a timely and professional manner. I would collaborate with the patient, their family, and the healthcare team to find a suitable resolution. 8. What is health and safety in the nursing home? Health and safety involve protecting patients and staff from harm or injury by preventing falls, ensuring safe care, and maintaining a clean, hygienic environment. 9. What is health and safety? Floor, bed, hot water, medicine. Floor safety, keeping floors clean and free from obstacles. Bed safety, using proper rails and ensuring the bed is in good condition. Hot water safety, checking water temperature to prevent burns. Medicine safety, proper storage, handling, and administration of medication. 10. How do you handle a patient's bruises? I would assess the bruise, apply a cold compress if minor, monitor the condition, and document the incident according to protocol. If serious, I would escalate it appropriately. 11. How do you handle aggressive patient behavior? Remain calm, speak soothingly, remove triggers, and ensure safety. If the behavior escalates, notify senior staff and follow protocol. 12. What are your strengths and weaknesses? Strength, effective communication with patients and team members. Weakness, sometimes take on too much responsibility. Working on improving delegation. 13. What would you do if a patient refuses care? Understand their concerns, explain the importance of care, and respect their decision. Document the refusal and notify the appropriate personnel. 14. How do you protect the patient? Ensure a hazard-free environment. Monitor condition and vital signs, and report any concerns promptly to relevant personnel. 15. What are 3 qualities of a good carer? Compassion, empathy, and patience. 16. What are the duties of a care assistant? Assist with hygiene, feeding, mobility. Administer medication, monitor vital signs, support emotionally, and maintain patient records. 17. How do you maintain a patient's dignity? Treat them with respect, ensure privacy, involve them in decisions, and listen to their needs and preferences. 18. What is dignity and privacy? Dignity, valuing individuals as worthy of respect. Privacy, Right to control personal and medical information and maintain physical, emotional boundaries. 19. What would you do if you witnessed abuse? Report immediately to a supervisor or safeguarding team. Document the incident and support the patient. 20. What if a patient is unhappy with your care? Listen to their concerns, make adjustments, involve the healthcare team if necessary, and document feedback and actions taken. 21. What is the biggest challenge that you foresee in this role? I had a number of challenges in my previous career, and since this is a larger role than the one I previously held, long working hours and exhaustion will be a hurdle I must overcome before taking on this role. However, I believe I can easily adjust and cope with the issue at hand by planning ahead of time to ensure that I have enough time to recover and continue with my regular routine without interruption. 22. What is safeguarding? Protecting vulnerable people from harm, abuse, or neglect. It includes identifying and reporting concerns appropriately. 23. What is confidentiality? Keeping patient information private and sharing it only with authorized individuals or when necessary for the patient's welfare. 24. Experience with dementia patient care. I have experience caring for dementia patients using techniques such as simple communication, calm demeanor, and patience to build trust and ensure safety.
25. What would you do if a patient's relative offered you money? Politely decline and explain that accepting money or gifts is against professional conduct and policy. 26. If you found a carer hurting a patient, what would you do? Report immediately to a supervisor or safeguarding authority and document the incident to ensure accountability and protect the patient. 27. How passionate are you about this field? I am very passionate about healthcare. I find meaning in helping others and continuously strive to improve my knowledge and skills to provide excellent care. 28. Example of a challenging work experience. I once cared for a nonverbal patient. Through observation and consistent engagement, I learned to understand his needs and built a strong rapport, which his family appreciated. 29. How do you ensure patient safety? By following safety protocols, assessing for risks regularly, maintaining a clean environment, and reporting hazards immediately. 30. What would you do if you witnessed abuse? Immediately report it to a supervisor or safeguarding team. Support the patient and document the incident in detail. 31. What should you do if a patient falls? Assess the patient. If injured, call an ambulance first. If not injured, move them safely and notify the manager. Document the incident. 32. What is moving and handling? Supporting patients in mobility and transfers using proper techniques and equipment to prevent injuries to both patient and staff. 33. What is the importance of teamwork? Teamwork ensures effective communication, collaboration, and coordinated care, which is essential for patient safety and well-being. Teamwork is crucial in a healthcare setting. As a healthcare worker, I understand the importance of effective communication and collaboration with my colleagues, patients, and their families. I believe that working together as a team leads to better outcomes for patients. 34. What is Basic Life Support BLS? Basic life support is a set of procedures performed in emergency situations to help save lives. I have completed BLS training, which includes cardiopulmonary resuscitation (CPR), the use of automated external defibrillators (EDs), and basic first aid techniques. 35. How do you respond when a patient chokes on food? If a patient chokes on food, I first assess their condition and encourage them to cough forcefully to try to dislodge the obstruction. If the choking continues, I call for immediate medical assistance and follow the appropriate emergency response procedures. 36. What are the skills you possess? As a healthcare worker, I possess a wide range of essential skills including strong communication and interpersonal abilities, attention to detail, empathy and compassion, the ability to remain calm and effective under pressure. 37. Why is food and fluid documentation important? Food and fluid documentation is essential for monitoring a patient's nutritional intake and overall health. It helps the healthcare team identify any dietary changes, assess hydration status, and make informed decisions about care planning. 38. Why should I hire you? You should hire me because I am a dedicated and compassionate healthcare professional with a strong commitment to quality patient care. I have the necessary skills, training, and experience to contribute positively to your team and make a meaningful difference in patients' lives. 39. What are infection control measures? Infection control is critical to preventing the spread of diseases in healthcare environments. I am trained in infection control practices such as hand hygiene, proper use of personal protective equipment (PPE), safe handling and disposal of contaminated materials. 40. Equipment you are familiar with. I am familiar with a wide range of healthcare equipment, including medical beds, wheelchairs, hoists, commodes, vital signs monitors, and other patient monitoring devices. 41. Do you know how to use a hoist machine? Yes, I am trained and confident in using hoist machines to ensure safe and comfortable patient transfers. 42. Why do you want to leave your current job? I am seeking new professional challenges and opportunities to grow within the healthcare field. While I have appreciated the experience gained in my current role, I am now looking for a position where I can further develop my skills and contribute to patient care in a new environment. 43. How do you stay motivated in your work? Caregivers provide invaluable assistance to individuals in need, and they don't just do it because it's their job. They're typically motivated by a strong desire to help others. This has always given me a boost of confidence in my job, as I get a sense of satisfaction and joy from witnessing how successfully my care is performed, and the patient feels better. Values that have been proved to have a beneficial effect on service quality, such as job meaning, solid interpersonal relationships, and respect, also aid my drive. 44. Describe the impact of a care worker. Care aides play an important role in the lives of the patients with whom they work on a daily basis. I understand they are in charge of all aspects of patient care, including bathing, dressing, and toileting. If the patient is in pain or uncomfortable, they must listen to them. Overall, I feel that a care worker must be actively engaged with the patient in order to improve their quality of life and that this should be done in collaboration with doctors and nurses. 45. What's the difference between working with an old and a disabled patient? I know that senior people have a larger predisposition to be self-sufficient and wish to do chores on their own. Based on my experience with them during my certification, I assisted an elderly gentleman who was having difficulty putting on his medical gown for his exam. I told him he didn't have to rush and that he could take his time. He requested help after a few minutes, and I assisted him in putting on his gown. I asked more inquiries about a disability patient's experiences when I worked with them to create trust and humanize their stories. 46. Imagine your patient has a heart attack. What do you do? I would first call for emergency medical care. If the patient is conscious, I would give aspirin, unless there is an allergy to it noted in their medical record. Then, if they had a nitroglycerin prescription, I would administer it. If the patient is unconscious, I would proceed with CPR until emergency help arrives. 47. Do you know what person-centered care is? The evidence is emerging that people-centered interventions may be more effective than prescriptive care. For improved health outcomes, you need to involve your clients in their care and allow them to decide what is best for them. It is not your job to do everything for your clients. Instead, it's about finding ways to engage clients in the process and assisting them where necessary. 48. How would you deal with a difficult patient? The employer wants to know if you can exhibit empathy in challenging situations. You should show how you manage to give high-quality treatment while demonstrating sensitivity and understanding. Sample answer. I believe it is critical to demonstrate to patients that we not only listen to them but also that we are firm and offer them the care they require. I say to the patient, I hear what you say. I'll be back in 20 minutes to see how you're doing. Though delegating is not one of my traits, I'd inform the nurse of the situation and ask for her opinion and perhaps for me to be reassigned as the caregiver for that patient. Then I'd return to the patient and consult with the family on the next steps forward. 49. Why do you feel you are most suited for this role? The interviewer is interested in learning why you believe you are the ideal applicant for this position. Highlight your unique experience and talents that set you apart from other candidates. Sample answer. This is a position that requires an experienced individual who can deal with a wide range of scenarios while maintaining a high level of professionalism and enthusiasm. I feel I possess all the necessary qualifications for this position. Having worked in this industry for 5 years, I believe I have everything it takes to be the care worker you are looking for at your establishment. Furthermore, I possess all of the tactics and abilities required for this role. I'd be grateful if you considered my 4 years of experience in this industry as an added advantage. 50. What kind of strategy and mindset is required for this role? The interviewer wants to know how you feel about this position. Discuss your attitudes and main priorities in the role. Sample answer. Strategic planning is critical in this role since it establishes the foundation for success. I believe my success as a care assistant is due to my strong analytical and leadership abilities. My capacity to detect even minor changes in my patients is a significant strength. I maintain a positive attitude even in the face of adversity. In my position, trustworthiness and accountability are crucial, especially when working with frail patients who may not be able to communicate their needs. Confidentiality is also essential when dealing with patients ranging from the elderly to the most vulnerable.